Hello, good morning class. So my name is Dr. Obedi. I will be with you in the module of management of communicable disease. So session number 1 is on the introduction of the communicable disease. We are going to cover this session not more than 30 minutes. It will be short, but I have to make sure it is clear. In case in between you have any question, you can just send a message and I think I'll be replying all those messages. So this is a learning objective. So by the end of this session, I expect all students in this online lesson should be able to understand these terms. So the first, you should be able to define common term which applied on this module. You should be able to identify importance of communicable disease. Why do we learn this session? You should be able to list common group, because we tend to group communicable disease for easy understanding and for easy learning. And then you should be able to describe mode of transmission of communicable disease. And then at the end, you should be able to describe the principle of communicable disease control as a part of prevention. So in definition of terms, we have these terms. We have communicable disease, we have epidemic, we have endemic, we have pandemic, and then we have nosocomial. So on communicable disease, as a part of definition, we say these are diseases which can be transmitted from one person to another person. Not only that, it also can be from one person to animal or from animal to person. And epidemic, this is a disease which appear in a human population at a rate which is high, different from that was expected of that community. And endemic is a term which describes the constant presence of a disease in a human population or in a given community. But not only the presence of a disease, but also the presence of infectious agent capable of causing disease in a given community. It can be termed as endemic. And when we say the term pandemic, this is a disease which affects large area or affect large populations. You can have a disease which affects a large continent or a large country. So this is a pandemic. So the last term is nosocomial. Nosocomial, this is also disease which someone acquires them while he or she is in hospital. So they can present as a sign and a symptom to that patient while he or she is in hospital, or patient may be with no symptoms but can present with symptoms after, most of the time it is 24 hours after discharge. So principle for disease transmission. Disease transmission in human require some component. We have some condition for a disease to be transmitted from one person to another person or from animal to person. The first thing is an agent which is capable of causing infection to man. It must be present. And then you should have a source. A source is an host infected by an agent. And then you must have a port of exit. This is a route in which an agent capable of causing infection will be leaving the source of infection to the animal to be infected. And then we have suitable means of transmission. It can be through aerations. It can be through skin penetration. It can be either way, in which the agent capable of causing infection is moving from the source to the host. And then you have port of entry. This is a way this is a way in which an agent capable of causing infection is entering the host to be infected. And then we have susceptible host. So the term susceptible here is very important because if you have a host and then it's not susceptible of getting that infection, you are not going to have a disease. So we have susceptible host and resistant host. Resistant host as a host which prevent itself from getting infection, and susceptible host as a host which is at high risk of getting infection. So there's medical importance of communicable disease. Why do we study this module? So you study communicable disease because of medical importance. The first thing is because many of them, they are very common. So if you don't study this communicable disease, you are going to miss a lot of them while you are practicing your medicine. And then some of them are serious, even cause death and disability to the patient. So you don't know how to manage a communicable disease, you are going to cause death and disability to the patient. And then some of them can cause widespread outbreak of disease, that is epidemic. So you should know how to manage. And then they are preventable, so you should study them thoroughly in order to be able to prevent them. And they are serious to infant and children. So group of communicable disease, mainly we have three groups. The first group is contagious group. Contagious is a word which came from the term contact. So this is a group which can be transmitted from one person to another person, or from animal to person, by direct contact or indirect contact. And indirect contact, it can be by handling contaminated object, such as clothing, bedding material, dressing, or home utensils. And by direct contact can be by skin to skin, like touching a person who is infected by disease. The second group is sexually transmitted disease and HIV/AIDS. This is a disease which can be transmitted from one person to another person through sexual contact. And sex can be heterosexual, sex between men and women, and homosexual, men against men or women against women. So in STI, the most way of transmission or predominant ways is through sexual contact. The last group is vector-borne disease. This is a disease which, to be transmitted from one person to another person, you need a vector. A vector must be present. The disease caused by fecal contamination. This is a disease whose causative organisms are excreted in the stool of infected person or animal, and the port of entry of this organism, most of the time it is a mouse. So by explaining this, you have fecal, which is contaminated by an organism capable of causing a disease, and then you ingest those fecal material. They pass through the mouse, then to the gastrointestinal tract of a person. That way we call fecal oral route, taking fecal to the mouse. Then you can have small quantity of feces, very, very small, but they can contain enough organism capable of establishing an infection. So contaminated food may look clean, may look with normal smell, may taste normal, and yet harbor a lot of pathogenic organism capable of causing infection to host. So hands that appear clean may carry and transmit enough microorganisms to spread disease. This is just put an emphasis to persons that you can have a clean hand and still you can harbor an organism capable of causing disease. Food play a central role in transmitting disease, as it can be directly or indirectly contaminated via polluted water, dirty hands, contaminated soil, flies, animals, or animal product. And hence are contaminated after defecation or by touching contaminated object. So the next part is the mode of transmission of communicable disease. This is a way of explaining how disease comes from one person to another person. Mode number one is direct contact. Direct contact, as I described earlier, that an infected person get in contact with an infected person. Or indirect contact, an infected person touch materials and then another person came to touch the same materials. So he will be touching also the source of infection which was left by the first person to touch those materials. The next part is the sexual contact, as we have in our second group, sexual transmitted disease, which means you have bacteria or virus in the one person during sexual contact or sexual intercourse. Those bacteria are being transmitted from those person to another person. Another mode is vector bite. This you have an animal who is infected by organism, and then those person is being get bite from vector. Let's say it is mosquito, and then those bacteria or protozoa or virus ingested by vector are being transmitted to another person, while those vectors get their feed to those person. We have fecal oral route. I already described a lot about this. We have feces contaminated with bacteria in the environment. Either way, either by touching or ingesting, you touch those bacteria, and then while eating, you eat together with bacteria together with your food, and then those bacteria goes all their way to the gastrointestinal tract, and then they tend to spread throughout the body depending on the pathophysiology of those organisms. The next mode of transmission is penetration through the intact skin, and then we have ingestion of infected animal product. Then we have inhalation or droplet infection. Mainly disease which transmitted through this way, you can think of tuberculosis. Tuberculosis is a disease which affects the lungs. So before going to the lungs, it tends to be infected from the droplet from infected person to another person. So prevention and control. We have principles of communicable disease prevention and control. So we group ways of controlling this disease in 3 ways. The first way is to attack the source, and then we interrupt transmission, and then we protect the host. This is a component of each of the ways are summarized in the next table. We're going to see the table in attacking the host, what we do, in interrupting the transmission, what we do, and protect the host, what we do. So this is the table. In attacking the host, if in attacking the source, if someone is being infected with the disease, is a source of infection. So what you will do, so that he cannot transmit those infections to another person, you treat that person. So the first thing is the treatment. The next thing, the person is infected with the disease. To prevent that person to transmit that disease to another person, what you do, you take that person, you keep away from the other people. So this is the isolation. You keep the patient away from the other people. The next thing is the reservoir control, and the last thing is the notification. Notification is that you give those information that I have a person with this disease and this disease who has high risk of transmitted that disease to another person, so that person can be kept alone. On interrupting the transmission, we have environmental sanitation. That means you clean environment so that another person getting in contact with that environment is not in contact with the bacteria. Then we have personal hygiene, we have vector control, we have sterilization. So in protecting the host, that means you prevent that host from getting infection. We have vaccine or immunization. You give vaccine to person so that he can become resistant against the infection. We have chemo prophylaxis. Chemo means chemicals, and chemicals means drugs. So you give some drugs to patient or someone who is not yet infected, so that he's not going to develop the infection. The best example of this is what we give when a pregnant woman. A pregnant woman is being given with the medication for malaria while she's not having a malaria. So we give SP, sulfadoxine, pyridoxine, to that pregnant woman, so that to make her resistant in developing malaria. We have personal protection, then we have better nutrition. So in better nutrition, we understand that the better the nutrition, the better the immunity, and then the resistance to infection. So when talking about prevention, we tend to divide into levels. We have levels. First level, which is primary prevention. We have second levels, which is secondary prevention. And then we have the third levels, which is the tertiary prevention. In each level of prevention, we do different things depending on the level. So in the primary prevention, this means that we prevent the host or the person from becoming infected or from developing a disease. So what we do is immunization, health education, promotion of nutrition, vector control, prevention of adequate housing, and hand washing. In secondary prevention, this means that someone has already developed a disease. What we do is that we prevent that disease from developing a complication, from developing advanced stage. So we identify the disease at the earliest possible stage, and then we give prompt treatment to that disease at the early stage. That is what we do in secondary prevention. The last part is tertiary prevention. This will refer that a patient has already developed a disease. So what we do, we prevent disease, disability, or death to that patient. This includes rehabilitation. So the things to consider as a part of key point in this session, you should be able to understand the keywords. To define the keywords. Should you remember the definition of communicable disease, definition of epidemic, pandemic, endemic, and nosocomial. We have already discussed. You are going to have your time to pass through those keywords, and then this is just to put more emphasis that communicable disease is a very common disease, and they are preventable disease by simple means. So as a part to remember this session on your own, you can take your time. You can read upon many group of communicable disease. You can take 5 minutes just by remembering them. And then you can record your response using your notebook. You can see if you are able to understand those session or not. And then if you have any question or difficulty in those groups of communicable disease, you can take your time and ask for any member of your group, or I'm also online on your e-learning modules. So evaluation, this is a slide used to remind you that what you have understood and what you haven't understood. So how do you define communicable disease? So just to remind you shortly that communicable disease, these are diseases which are transmitted from one person to another person or from animal to person. And then mention main 3 group of communicable disease. Again, to remind you, group number 1 was contagious group, as a group which can disease which can be transmitted from one person to another person by contact, which can be direct contact or indirect contact, as simple as that. And then group number 3 was sexual transmitted disease, and then we had vector-borne disease. Ways of communicable disease control. This question is a little bit technical. The way to approach this question is the same way. You have to concentrate on the protecting the host, on the interrupting the transmission, all those things we have already talked about. So after saying all those, this marks the end of the session number 1, and this is a reference book. So if you have this book, you can just pass through to have more knowledge, and this is the end. So the next session we are going to have on tomorrow at 2 p.m. we are going to have the second session. Have the good day. Bye.